Okay, this is how we do muscle stretch reflexes or MSRs. We're going to use the tip of the hammer for everything except the Achilles, in which case we will use the flat end for the Achilles. Some of the times we'll use our thumb, some will not, and we'll walk through that as we go through it. Sometimes when you're not sure if it's a 0 or a 1 plus, you may have the patient reinforce the maneuver, which is also called Jandrisic. When we're examining the upper extremity, the way we do reinforcement, we tell the patient to hook their legs together, like that, and then while we're checking the MSR, we'll tell them to pull out and bite down. And that will be reinforcement where we're examining the upper extremity. When we examine the lower extremity, we're going to tell the patient to put their hands like this together and pull out and bite down. And that will reinforce the lower extremities. If we're doing S1 in a prone position, we'll tell the patients to reach over their head, put their hands, because they're going to be on the table, put their hands and pull out and bite down, and that will be reinforcement for S1 and L5, because those are done in prone position sometimes. All right, so let's start with the biceps. The first thing to do with the bicep is make sure that the arm is hanging perpendicular as much as possible. You will use a thumb, and the best way to find the tendon is to tell the patient on a supine position, tell them push up against me and hold it, and you're going to identify the bicep, and you're going to palpate the bicep, and as soon as you fall off the muscle into the tendon, relax. You're going to press down on the tendon, you're going to grab the hammer and strike. And that would be a 2 plus. I can feel it more than see it. Then you come to the other side. I'm right-handed, so I will come reach from the inside. So go ahead and, let me get this out of the way a little bit so we can see it better. There you go, thank you. Go ahead and pull up. There's the muscle. There's the tendon, relax. Make sure you hold the arm. And that would be a 2 plus. Another way to test these is you can actually hold the patient's arm like this, push up against me, find the tendon, relax. You can hold it and you can test it, okay? That would be a C5 biceps. C6 brachioradialis, we're gonna have the patient hold it half supinated, the arm, make a fist, and bring it up. And now we're gonna palpate the brachioradialis as we try to put this into from radial flexion to ulnar flexion. And we're gonna come in and palpate. As soon as you come off the muscle, you can do it right here, relax. Hold the arm, relax everything. And then we should get primarily, if we're in the right tendon, we should get primarily elbow flexion. That's what we're looking for. If you get anything else, you're on the wrong tendon. It's primarily flexion. There's maybe some supination, but it's primarily flexion. It's the same thing on the other side. Make a fist, hold it up. Don't let me bring it down. Palpate the muscle as soon as you're on the tendon. Relax. Traction. And you should see a lot of primarily elbow flexions. That is C6. C7 is triceps. So triceps, the key thing to get a tricep is making sure that the patient's arm is relaxed. You're gonna hold it, you can have them push out so you can find the muscle and the tendon, which is right there, relax. Then you can just tap it, and if I hit it right, I should get that elbow extension. You can hit the anterior tendon or the posterior tendon, it's up to you, but make sure you hit that tendon. Sometimes this one does require a thumb, it's up to you, but normally it does not require a thumb, like the first two did. And once again, hold it up, push up against me. There's the tendon, relax. And if I get it right, here it is. I get a little bit more, guess I get the other one. There we go. I'm now using the back tendon. I can get a bit of reflex. Now sometimes if the arm is big, another way you can check this, but it requires you to have awareness of where your hammer is. You can put your arm, you can put your hand underneath your arm, palpate the tendon, go ahead and push it, push down, there you go, relax. You're gonna stand here, and as you hit it, you're gonna see the arm go into extension. This requires that you know where you're hitting with a hammer, and this is another way to check the triceps. It's a little bit easier when they have large hands. C8 is finger flexor, so put your hands like this. The secret to this one is that you come as distal, put your fingers together, you come as distal as possible, and you just put just relax a little bit. Just enough tension to feel the muscles kind of talk to you back. If you go too far, it's not going to work, and if you don't put enough, it's not going to work either. So you just want to put a little bit of flexion into it, and then you tap it, and you should see a nice brisk response for C8 finger flexors. Same thing here. Go as distal as you can with your finger, and then you should get a nice C8 finger flexion response. That is the upper extremity. Lower extremity, there's 3. Patellar, L4. The main thing about the patellar is locate the tendon. It should be medial, but a lot of us are losing a little bit of the VMO so that the patellar tracks laterally. So you make sure that you come at the patellar, feel it, and tap it. And then let it do its thing. And then don't hit it again until it stops. Oh, by the way, all of those were 2 pluses. This is pushing toward a 3 plus, but it's not quite there. It's a very, very brisk 2 plus. I would not call this a 3 plus yet. Now, if you notice, it's swinging more than once. That's called a pendular swing. And a pendular swing is significant of ipsilateral decreased cerebellar output. And in this case, it's bilaterally. And the way you're going to grade that, this is a 2 plus MSR with pendular swing. The only place you'll see pendular swing is in the patellar. And it's only when you test it with a patient sitting. If you test it like in some of the pictures you might see with a patient supine, you're not going to see the pendular swing. So the only way you'll ever see pendular swing is when the patient is seated and the leg can freely move. The way you're going to count those is 1 to 2 swings is normal. 3, just let it be. 4 plus swings, call it a pendular swing. Okay? So we're going to go to S1 first, and we're going to come back to S1 again and L5. So S1 is the Achilles. This one we'll use the flat end of the hammer. The secret to this one is that the patient does not help you. If they help you, you're not gonna get it. Secure the joint right here, and then with the bottom of your hand, the other side of it, just dorsiflex passively as much as possible within what the patient can give you. Once you're there, take the flat end and go tap, 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 and that's a 2 plus. Go to the other side, do not stay in the middle of the patient. Secure the joint again with your thumb, come underneath, dorsiflex, tap, 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 and that's 2 plus on the Achilles. Now we're gonna do the same thing on the Achilles with the patient supine. Go ahead and lay face down, please. So if you don't get a 2 plus seated, before you call it a 0, you may want to check it this way. Have the patient prone. With your index finger, secure the same joint we were at earlier. With your thumb, go to the plantar area and passively dorsiflex it. Make sure that their knees are at 45, not at 90 or less than that. About 45 is where it should be. Come with a hammer and go tap, 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 tap. Okay? Go to the other side. Finger, thumb, dorsiflex, tap, 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 and let's do 2 plus bilaterally. Now we're gonna reinforce this one to show you how you do it, and with reinforcement, I need you to put your hands by your head, cup them like this, and pull hard and bite down. This one does not need reinforcement because it's already a 2 plus, but if you have to reinforce it, you have the patient do that, get the leg ready, and say pull, and then you would see the reinforcement come in if it was present, okay, for the 1 plus. Now, go ahead and stop reinforcing. May I lift your pant legs a little bit to expose the hamstring? Is that okay? Yep. Okay. So the medial hamstring, we need to see the muscle because this is where the muscle is, proximal to the knee. And the way we're going to find the muscles right here, we're looking for this to move when we do the reflex. This is L5. You're going to tell the patient to hold the leg up a little bit, and then don't let me push down, and you're looking for or feeling for the tendon, which is right there. I can feel it. The medial hamstring is L5, lateral hamstring is S1. We always test for L5, the medial. So once we find the tendon, just like before, we use our thumb, relax, we press, and we go tap, 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 and there's the 2 plus. See it contract? That's the 2 plus. If you could stay on this side, hold it up, don't let me push down. There's the tendon, relax. tap, 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 and that's an L2 plus L5. Thank you for letting us do that. Okay, go ahead and sit up. Okay, we're good?